Thank you for joining our 5th discussion in our AAA Northeast Teen Driver Safety Series, everyone. Today's topic is ADHD and driving. It's a topic that I said this last week, but similar to drowsy driving, we don't think that this topic gets enough attention. So we're very excited to bring you this information today. We'll be offering parents and new teen drivers some practice this afternoon, and we'll also hear from 2 outstanding women who are researchers at UMASS Amherst, Assistant Professor Dr. Shannon Roberts and Associate Professor Dr. Jennifer McDermott. Right now, you probably can't see Dr. McDermott on your screens, but you will be hearing her voice. You will see Dr. Roberts here with us. And I just want to begin by telling parents and teens out there that last year there was an article published in Pediatrics, the publication titled Pediatrics, that outlined research where crashes, violations, and license suspensions were analyzed for 15,000 teen drivers, and about 2,000 of those teens had been diagnosed with ADHD. So the events within their first 4 years of licensure were analyzed, and I just want to share a few of those findings from that research with you now. In that 4-year period, for those with ADHD, there was a 37% higher crash rate for those without ADHD. And the ADHD group had a 62% higher rate of injury-related crashes. I know parents, that's everybody's worst nightmare for the ADHD group, and a rate 109% higher for alcohol-related crashes. There was a 36% rate of moving violations for that group compared to 25% rate for those without ADHD. And 17% from the ADHD group had license suspensions compared to only 10% of those without. So also that ADHD cohort had a higher risk of crashes in their first 30 days of driving, which is pretty common to have incidents right at the beginning. But these facts certainly inspire us at AAA to make sure that we included this topic in the series and that we understand that ADHD it's really common. It's a common challenge for many of our students, many of your children. And, parents might hear this information and think, well, let's put off driver education for a year. Let's give them time to develop, possibly grow out of this a little bit. The science tells us that even delaying licensure from age 17 to 18 didn't make a difference. In fact, ADHD folks struggle with driving into their adult years as well. So it's not really something that we grow out of. So, based on the research, I'm happy to share, there's not all bad news though. There is kind of a silver light, and that's having lots of behind the wheel experience. So the parents that are taking the time to get in the vehicle to practice driving with their teens for an increased amount of time really do help them to form good habits. And so, for example, in Massachusetts, there's 40 hours of behind the wheel practice mandated prior to a road test. Here where I live in Rhode Island, it's 50 hours. I would provide 150 hours. Just go above and beyond in that behind the wheel practice. Keep going out even after your teen receives their license. I always say that little piece of plastic does not make them an expert or even a safe driver. So the answer isn't necessarily putting off driver education, but it might be helpful to hold that permit for a longer period of time to ensure you can get practice time in, as well as practice in different driving environments. So many of us, when we start out with our kids, kind of, home to school, home to the supermarket, but different types of weather, daytime, nighttime, various roadway designs. That's really helpful. And the other factor to consider in all this, and I know you'll hear this from our experts here today too, but think about it in terms of graduated driver licensing. In Massachusetts, they call it junior operator's license, but GDL laws no longer apply to young drivers after they reach their 18th birthday. And these restrictions do offer some protection by limiting the number of teen passengers allowed in the vehicle with your teen, or restricting them altogether. It mandates a curfew. It really restricts use of electronic devices. So, we know that ADHD contributes to driving risk because of difficulties in executive function, including poor judgment, risk-taking, thrill-seeking, and of course, inattention can lead to distractions, and impulsivity can lead to poor reactions to, other driving conditions. So our experts will tell you that the single most significant challenge for drivers with HD is impulsivity and the failure to avoid distraction, probably even worse for young drivers. So you may have wondered in this technology era how autonomous vehicles can contribute to safety and possibly help to compensate for their inattention or their impulsivity. So at AAA and the AAA Foundation, we're always eager to investigate autonomous vehicle technology. We are so thrilled that we found Dr. Roberts and Dr. McDermott, and they were able to be with us today to explain the research that they've completed at UMass Amherst. And their research, by the way, was funded by the Institute of Diversity Sciences, known as IDS, right, over at UMass. And before they begin, I feel that IDS really deserves a plug because this is just really exciting. It's a multidisciplinary unit that brings together the faculty and the students from across UMass and the 5 college consortium in order to promote equity-inspired research. So the goal there is also to nurture the success of diverse students, and they are the future. They're our future generation of scientists and engineers and technology experts. And as you can see clearly illustrated in the research that they're going to share with you today, they're connecting scientific research to social impact. And Dr. McDermott's background is in psychology. Dr. Roberts is in mechanical and industrial engineering. So when those two got together, some really cool stuff happened. So we're going to show you a quick video just to start us off. If it'll play, hopefully it'll play.
For individuals with ADHD, there's a lot more risk of getting into car accidents. There are more infractions that occur, speeding tickets, moving violations, all those sorts of things.
So previous research showed that an automation system in a car decreased the situation awareness of the driver in a way that they actually overtrust these systems. This is more risky for young drivers, and specifically for young drivers with ADHD.
For this project, my students and I are assessing how specific aspects of attention relate to vulnerability for distracted driving.
We expose them to the technology in the driving simulator, and we also see how they respond to different distracting tasks. So we measure their driving behavior, like their speed and their acceleration, but we also measure their eye movements to see exactly what they're looking at when they're driving.
And what this will help us to do is to understand how individuals with ADHD might function differently when there are distractions or when there are automated features.
We're trying to unpack which aspects of attention in youth with and without ADHD place them at the most risk for distracted driving.
The research that we do here will hopefully inform policy that has to do with distracted driving, because now we have quantitative evidence of how dangerous it can be when you're doing distracting tasks, and at the same time, how new technology can sometimes allow you to do those distracting tasks, but still not compromise the task of driving.
With this understanding, we can help to promote inclusion and provide assistance through possibly targeted trainings.
When I was a graduate student, I got to see how my little brother learned how to drive. And for me, it was an eye-opening experience because I saw that as times change, generations see different things in terms of what's in the car.
What I've gained by working with Professor Roberts has been an alternative perspective on our research.
When you collaborate with someone who's outside of your discipline, you learn so much more. They are exposed to contacts and research and different tools and techniques that we've never heard of, but that are incredibly valuable for enhancing our research.
Okay, we're going to go right to Dr. Roberts and Dr. McDermott now, so they can tell us more about all the work they've done.
Yes, thank you for that lovely introduction, Diana. I think the slides should start soon.
Your
Am I right?
slides, yeah. Here we go.
Perfect. Okay. So like Diana said, I am Professor Shannon Roberts. I am in the Mechanical and Industrial Engineering Department, and my colleague Jennifer McDermott is in the Psychological and Brain Sciences Department. And today we're going to be talking about our project that just wrapped up that focused on ADHD teen drivers and how they interact with different technology in the car and how we can correlate their driving behavior with some really cool attention measures that Professor McDermott's going to talk about. So let's see, next slide. There we go. Okay, so you heard a lot of these statistics just before we started, right? That recent article in Pediatrics says the same thing. We know that teens with ADHD, they're more likely to get moving violations, so things like speeding tickets. They're more likely to drive recklessly. They're more likely to get distracted when they drive, and they're just simply stated more likely to be involved in a crash. So this is a vulnerable group of drivers that, as researchers, we really want to help. We really want to make sure that teen drivers with ADHD are getting the same benefits of driving as teens without ADHD. Next slide. So that brings us to automated driving systems. They offer promise for these vulnerable teens because they automate the task of driving. So things like moving violations, getting distracted, those issues that teen drivers with ADHD are susceptible to sort of go away if you have technology that's doing the task of driving for the teens. So that's what we decided to focus on with this study. We wanted to see how this technology could help teen drivers with ADHD, and we also wanted to correlate their behavior when they were in the car with attentional and neural measures, which Professor McDermott is going to talk about on the next slide.
Great. Thank you very much. So as Shannon was mentioning, one of the things that I spend a lot of my time thinking about is individual variation in attention measures. And this is really important to think about from a developmental perspective. And it's also very, very relevant for certain populations like children with ADHD. And many of you may be aware that the core neural region that we're interested in is the prefrontal cortex. And so a lot of the skills that are necessary for driving efficiently behind the wheel of a car are actually things that are situated in the prefrontal cortex. And this is an area of the brain that continues to develop from early childhood all the way up through young adulthood. So it's not necessarily fully formed by the time your teen is getting their driver's license. And so this is important for us to know. One, it's a vulnerability, but two, it also means it's a strength because it's a time when it's developing and growing, and that extra practice that Diana was mentioning could really be sort of utilized well during this time period. And we know the main functions that are often talked about in regards to children with ADHD and their developing prefrontal cortex, there's a lot of this conversation about executive functions. And so there are several of them. We're going to focus on just a few here today. The first would be working memory. The second would be inhibitory control. And the third would be selective attention. And so this is the easier way to think about it. Working memory is how good are you at holding information in mind about what you're supposed to be doing and how you're supposed to be doing it right now. Inhibitory control, you can think about that as how good are you at controlling your impulses. And selective attention, you can think about it as how good are you at resisting distraction. And so there are a great deal of variability in these skills in typically developing children and teens, and especially also among individuals with ADHD. And I think this is a point that we tend to gloss over sometimes, but in a diagnosis of ADHD will look very different across different children because there are many attentional skills that we need to incorporate, and some kids have more difficulty in some of the skill sets versus others. And another thing that I'll mention right here is that all of these attentional skills can be challenged in emotionally laden contexts. And so you can imagine for a teen getting behind the wheel, that can be something that's super exciting and super fun, and that's going to pull on their attention in a different way. Or if another driver does something that frustrates them, or that they have just had a bad day and they get behind the wheel, those emotions are also things that can impact how effective these skills are at any given day and time. Next slide, please. So what we wanted to do, I had this great conversation with Shannon. I remember it was very basic. I was also asking questions about, you know, Shannon, I have a new car and it's got these bells and whistles and it's doing unique things. It's beeping at me, and what does this mean, you know? And so we were really talking about both of our lines of work and saying there's a lot left for us to discover, with the hope being that if we can make this combination of how we understand things about attention, variability, and these specific skills of attention, as well as what's happening with automated vehicles, what are the different driving skill sets that kids need to be aware of, can we actually take and combine this information to examine attention and how that impacts driving in kids, and to also then combine it with what's going on for kids who have varying levels of attention skills when they are in an automated vehicle. Because one thought is, yes, that actually should help, but another thought is that actually it might hinder, and we might want to be thinking about a more sort of multimodal approach to training our young drivers and really trying to do a better job of preparing them and sort of making that learning experience more in depth. Because right now we know that medication helps youth with ADHD when they're behind the wheel, but I think that's something that's very dangerous to only rely on one thing when we're trying to help our kids become really efficient, really safe drivers. And so Shannon and I are thinking about how can we take advantage about what we know of helping to promote good attentional skills and also helping to use technology in a way that will really maximize the strengths of an individual driver as well as help with those weaknesses that they might have. Next slide. So this is a picture of the car, and you saw it in that nice video that Diana played at the beginning for us. It's really quite fun, and it's surrounded by those screens. And so what we can do is design different drives and different situations for the students to actually be doing when they're in a real car, which is very different than if you're just sitting in front of a computer screen and pretending you're in a car. This is a real full car here. Next screen. And so these are the kinds of tasks that they would do when they come to my lab. So Shannon's lab has that really cool car. My lab has just the really cool computer screen. And so I want to tell you about a couple different ways that we can measure some of these really specific facets of attention. And so the first thing up there in the corner is working memory. And for this, again, this is when you're thinking about how good are you at holding that important information in mind, the rules about what are you supposed to do behind the wheel, how do you do this, what do you need to remember. And so what happens is that a child would sit, and for this one, this is our only auditory task. They would look at the green box on the screen, and the challenge is, it's called a digit span. They would hear these numbers, things like 8, 2, 7, 4, 9. And we start in small increments and we go up to 9 digits in a row. And after you hear those numbers, you have to repeat them back. Now, the real challenge comes with when you hear those numbers and you're asked to repeat them backwards. So we have different levels of challenge which allow us to pull apart sort of, you know, who's got sufficient working memory and who's really challenged at the easier levels or the harder levels of this. For inhibitory control, that's where we're saying, like, how good are you at controlling your impulses? What they would see on the screen is one letter at a time. So all of the letters of the alphabet, A through W, Y, or Z, are flashing on the screen, and they are told that their task is press a button every time you see a letter, except for the letter X. And this task, despite sounding very easy, is actually quite challenging, because what happens is you build up this prepotent response. You're pressing the button, the letters are flashing pretty quickly at you. And so when that X comes up, you have to work really hard to not press the button. And you can think of the analogy, you know, you're going in the car and you're going and going and going, and something sort of jumps out and surprises you. How quick are you to react in that situation? So this is how we can get at it in the lab setting. And then for selective attention, this is how good are you at resisting distraction? And so what you would see on the screen is any one of these rows of letters at a time. So you might see a row of S's or a row of H's, and you're told, please just pay attention to that middle letter in the row and don't worry about what's flanking it on the other side. And so when it's a row where all the letters are the same, they're congruent, it's super easy. But when those flanking letters are different, this is a huge conflict for your brain to work out. You've got, you know, two good things going on at the same time, and it's actually really quite tricky to ignore that extra information. So when you think about being behind the wheel, all of the things that are going on in the car, all of the things that are happening in the context outside of the car, we also wanted to say, you know, can we make some associations between resisting distraction in this very focused way in the lab, and how that might influence performance in the car. Okay, next slide. And here's the extra piece that we've added. This nice student here, a former student of mine, he is demonstrating an EEG cap. So EEG stands for electroencephalography. And basically everybody has electrical activity going on above their head all the time. It's because your brain produces this activity. We just can't see it unless we put a cap on. When we put this very special cap on, what we have are some sensors, and we put in some nice liquid, we connect it to our computer, and we can see what your brain is putting out all the time in regards to electrical activity. And people have been studying EEG for decades and decades now, and so that we can take certain patterns that we know are in the EEG signal and link them to certain states. And so for this study, we're really interested in what's going on with alpha EEG. So it's a particular frequency band, this pattern that we see. And what we know from many, many, many other studies that have been done is that if you have this sort of higher level of this resting alpha frequency, you're at a state of lower alertness. So if you come in and you're kind of drowsy, we're going to see some pretty high alpha going on. And so this is a way that we can think about taking a measure of what's happening with your attention without a participant having to perform, or without a participant having to sort of self-reflect and say what's going on with their level of alertness. Thank you. Next slide. And so then just to jump right into it, what are the kinds of things that we're seeing when we say, let's take these very specific skill sets of attention and combine them with skill sets of how participants are doing when they're in that driving simulator there in Shannon's lab behind the wheel. And so one of the things that we have seen so far is that the better you do on that auditory working memory task, the less drifting you do between lane lines, okay? So here what we want is the blue bar, the high working memory is low, because that means you're a steadier driver. The better you do knowing what you're supposed to be doing behind the wheel, the steadier you are going down the road. Next slide. And so then for inhibitory control, the one where you really get into sort of this prepotent pattern and you have to stop and control any impulse to keep going, what we see is that there are changes in how you brake and how you accelerate. And so basically, the more efficient you are at stopping yourself when you're in this sort of pattern of responding, when you can quickly control that, you have more efficient braking and acceleration happening. Next slide. And then you might notice I skipped right over that task that was looking at selective attention and distractibility, and it's because we actually haven't found a map between our lab-based measure and what was going on in the car. And that may be because this is when you take something out of the normal environment and put it in a lab, sometimes it doesn't work the same way. So in the lab environment, there are a lot of things that are quite controlled. And so I think we haven't sort of hit the main sort of distractibility feature that maps yet onto what's going on the road. But we did find something for our neural measure when we were looking at that EEG alpha. And so how alert a participant was. This was linked to how much you would be drifting in lanes and how much you were making adjustments in your steering wheel. And for this part of the driving scenario, we want folks to be steady. We want that steering wheel not to be moving a lot for this part of the driving scenario. And so basically, if you had lower alertness, you were a more inefficient and unsteady driver. And one of the things to bring up here is to highlight when they were doing these measures of attention, the behavioral measures and the brain measures, they were in my lab, and then they went and did the drive in Shannon's lab. And so what we're finding are some really interesting connections of possible markers, right? Who might have these kinds of vulnerabilities that exist before they even get in the car? And future work, Shannon and I are interested in looking at some versions where we can take some EEG caps and put them on the participants when they're in the car. But for now, we're just sort of really excited to see that there are these connections of how your levels of attention skill map onto what you're doing when you get behind the wheel at another time of day. Next slide. And so just to summarize this sort of initial behavior and brain measure attention piece, the ones that really popped out were working memory, so holding the information, inhibitory control, can you control those impulses, and how alert you are. And that this variation, I should highlight, this variation was among our participants who had high levels of ADHD symptomology. And so this is sort of a unique approach. We're not just saying for this section, we're not just splitting them on ADHD and non-ADHD. I was showing you within the ADHD group, there is a lot of variability of what's happening with these different kinds of skills. And so when you're thinking about how can I best help my child with ADHD as they approach their licensure and want to be a better driver, you really have to be able to think about their specific strengths and weaknesses. And the good news is that these skills can be supported in different ways. Now, this is not to say an individual who has an attention difficulty in any of these areas will be able to regain super high levels of it. But what you can do is you can maximize an individual's level of these skills. Things like rest, practice, and also medication can help with some of these skills. And so the other thing that Shannon and I were interested in, as we mentioned before, was the technology piece, right? How can we use technology in an efficient way? And so we needed to start to explore. And now here we're just saying between individuals with ADHD and those without ADHD, what happens with automated technology when you are faced with different kinds of drives? Next slide.
Okay. So, like Jen was saying, the students came into the driving simulator lab, and we wanted to see how they interacted with this automated technology. And we did that by focusing on scenarios where a hazard would sort of present itself, and we measured their response to that hazard. So the first situation you can see on the left is an intersection. So we see the car approaching the intersection, and there's a pedestrian that you can't see because they're hidden behind a building. And this pedestrian is about to cross at the crosswalk, but you can't see them until you get really close to the intersection. So in that example, we want the person in the car to look behind the building to see if there's a person there who wants to cross the street. The second situation is a combination of a merging roadway and a hidden driveway. So we have the car that's merging with the left lane. And in that merge area, you can see that there is a block of trees and there's a bicyclist who's trying to exit from the driveway and join with the road. So in this example, we want the driver to look beyond the trees to make sure there's no one coming out of that hidden driveway and we want them to successfully merge with the left lane. The example on the right is a curve. So the car is coming around the curve. There's a truck parked on the side of the road that's blocking a pedestrian who wants to cross at the crosswalk. So as the driver is rounding the curve, we want them to slow down and look beyond the truck to see if there is a person there who wants to cross at the crosswalk. So with each one of these scenarios, we had the students come in and drive them once with automation and once without automation. And we wanted to see if they performed the same when automation was on or not on, in addition to looking at if young drivers with ADHD perform the same as young drivers without ADHD. So next slide. The first set of results has to do with if the driver actually looked beyond the building, beyond the trees, and beyond the truck to see if there was a hazard that could present itself. So first I wanted to look at how ADHD drivers performed in comparison to non-ADHD drivers. And in general, they were pretty similar, but drivers who had ADHD detected slightly fewer hazards. So they looked for those hazards slightly less than those who didn't have ADHD, but it was a very small difference. I think it was on the order of like 10%, very, very small. Next slide. So the next thing that I wanted to look at was if their ability to anticipate hazards was different when they were driving with the automation on versus with the automation off. And once again here, of course, as you suspect, when the automation was on, they were not looking for hazards. They were letting the technology do what they thought it was going to do, which was drive and not crash. And they didn't look around them to see what was happening. This was the case for both drivers with ADHD and drivers without ADHD. And the difference in how they drove with the automation on and with the automation off was the same whether or not they had ADHD. No matter who you are, you think automation will do a great job and you don't look out for hazards. Next slide. So in addition to making sure they look out for those hazards beyond the truck, beyond the building, and beyond the trees, we wanted to see if they did things to potentially mitigate a hazard. So we wanted to see if they slowed down in preparation for a pedestrian that might jump out. And we wanted to see if maybe they would turn the steering wheel a little bit so they can see around the trees, the truck, or the building. So when we're looking at ADHD drivers versus non-ADHD drivers, we saw in general, when it comes to mitigating hazards, ADHD drivers tend to drive faster and they brake less often. So the braking less often becomes really important because when you get to these hazardous situations, you actually want them to brake quickly and often because it means that they're anticipating that something might happen. Even if nothing happens, it's better if you do brake and you brake often, just in case. And we found that ADHD drivers braked less often than the non-ADHD drivers. Next slide. So when it came to comparing this braking behavior in the automated versus the manual condition, we saw that in general, when automation was on, velocity and acceleration stayed the same. So people weren't really thinking that the automation, people thought the automation would handle whatever hazard would present itself. They weren't thinking, I need to take back control, I need to brake, I need to slow down, I need to steer to the left or to the right of the lane. When automation wasn't on, they were saying, okay, I need to move this way, I need to brake, I need to slow down. So the difference between ADHD and non-ADHD drivers in terms of this mitigating hazard behavior was pretty similar. We didn't see any large differences between those two groups, which was good. Okay, next slide. So to summarize, we saw that both drivers with and without ADHD, when automation was on, they simply weren't looking out for hazards on the road. They thought the technology would just take care of all possible situations that would present itself. This can be dangerous because not many people know this, but the technology still isn't perfect yet. There are a lot of things that it can't do. It can't see around corners. It can't see around curves. It can't see behind buildings. It can't see behind trees. So if you can't see it, it's highly likely that the car can't see it. The other thing that we saw, even though there was no difference between the ADHD and the non-ADHD drivers in terms of braking patterns or steering behavior, we saw in general that when it was on, of course, their velocity and acceleration was constant. It was very, very steady. This can be really beneficial for young drivers with ADHD who tend to have more erratic behavior. So we have this assistive technology. People think it performs great, so they don't look to see if hazards present themselves. But on the other hand, it makes the driving experience very, very smooth. Velocity is constant, acceleration is constant, which is really good for young drivers with ADHD. So, assistive technology can be a hindrance because people think it works perfectly, they're not looking out for hazards, but it can be a huge help to young drivers with ADHD because it makes their behavior steady and straight. Next slide.
Yep, and so now what we just wanted to do was take a few minutes and try and pull some of the information together about what might be some things for you as a parent or as a driving teacher to be thinking about when it comes to driving teens with ADHD. So the first thing I wanted to say, there is a load of information out there, some really good stuff. I have sort of just skimmed the surface and tried to put it in a way where we start off with this point that it's important for you as you are delving through information and thinking about what you might be doing within your family, that the attentional and behavioral challenges that occur in the home and in school for children with ADHD also impact children behind the wheel. Okay, there's nothing magic about a car that is going to make everything work just great, and that this is the point we wanted to drive home with some of our attention findings, that your child may have some very specific challenges, and the more aware you are of those challenges, the better supportive structure for learning and maintaining driving privilege you'll be able to put together. And it's also incredibly important for your child to be aware of their challenge areas. And this, I'll go back to at the beginning, I was saying that there's this connection between your attention, your behavior, and your emotions. And so your child may not have difficulty with some of the various executive function skills in general when environments are calm, but they may find that they are particularly challenged in an affective and emotional situation, which we know a lot of crazy things can happen when you're behind the wheel, and it's not necessarily something you're doing, but what's happening with other drivers on the road. So you need to help your child think about these different levels of challenge, both the attentional and the emotional, that happen when they're driving, and involve the kids in creating guidelines for safe driving. And the other big piece to think about would be for medication. Individuals can take different amounts at different times. And if your driving that you tend to be doing during the day is at a time when your medication is waning, or you have short acting medication, then the medication, even though you take it, it's not helpful if it's not fully active when you're behind the wheel. And also sometimes children go through different changes in their medications that they're taking. That can influence, so perhaps they've been doing fine with one medication behind the wheel, but for whatever reason they change. You need to think about them when they get back behind the wheel again. Next slide. The other big take-home message would be thinking about setting clear rules and expectations. For individuals with ADHD, you might want to consider an incentive system for driving practice, as well as maintaining the privilege of driving over time. And you can also be using that practice time to discuss challenges of driving with children with ADHD and process the experience. So one thing I have heard in a presentation is these very basic questions of, were you distracted, and by what? And letting the children know everybody gets distracted behind the wheel, and it's important for us to have an awareness about what distracts us the most. And thinking about in terms of setting limitations, necessary outings at first, so to school or to a job, and then building up over time after there's been efficient time to practice. And limitations for night driving passengers. There's lots of research showing that even children without ADHD, as soon as you put peers in the car, things change. And they have also looked at this from a neural perspective, where they have done this looking at brain reactivity. And it's very, very different for teenagers when their peers are in the car. And other basic things like, of course, you can think about if you would like them to use the radio, there are ways that you can set some limitations. So have preset channels ready to go. Next slide. And then when you're thinking about, perhaps you're at the early end of this, like I am with my recent teen, there are a variety of programs out there. There are some driver education programs that do have a focus on specific needs of individuals with ADHD. These are just some examples of one. There are probably many others out there. So one is Behind the Wheel with ADHD. They have this pre-drive app. There's an example of the screen app over here. So to have kids do a little bit of a checklist right before they get in the car, and asking them questions like, are you hungry? Do you know where you're going? And there's also one called ADHD Safe Driving Program. These are just examples. Also for traditional driving programs that might not have a focus specifically on ADHD, if you have an individualized education plan with your child, you can feel free to talk to that driving instructor and say, here are things that work for my child in school. Are any of these strategies things that we can think about behind the wheel, and how can we help these strategies work in the context of driving? And as Diana mentioned, that there is this sort of ambiguous area with delay. So I would say for maturational reasons, it is okay to delay to the point where the child is feeling they're ready to do this, but I wouldn't say delay for a very long time, because as Diana mentioned, the licensure requirements vary. So if a child needs extra practice time, and so they're not going to get their license because they're taking 6 months longer for practice, that sounds great. If they're delaying, but there's no practice, there's no learning, there's no plan that goes with this delay, that is an area of concern, because you may have less requirements by the time they go out for their license, and inadvertently then less practice, and they may be less safe. And there are many, many, many other resources out there. I just wanted to highlight a few of them here. Particularly the Children's Hospital of Philadelphia has a whole Center for Management of ADHD that has some very good specific driving information within it. So do check those out and think about what's going to work really well for your child and their specific needs. Thank you.
Great. And I'm going to ask for their email addresses to stay up on the screen for just a few moments while I take some questions for the doctors. I'm sure you'll probably be getting some emails from parents with specific questions. But I was so eager to hear the findings of your research, because about a decade ago, I know there was some research that came out that showed a huge benefit for young drivers, especially those with ADHD, to start driving on a manual transmission, like a stick shift, as opposed to automatic, because it just really required more input, more attention. And so probably for 10 years, all the education that I've done for AAA, when I speak to parents with these concerns, I'm like, I know they're not as easy to find, but try to find a stick shift for your child. So, thinking of autonomous vehicles that require even less input, I was just so eager to hear about your findings. And I have to say that the foundation, the AAA Foundation for Traffic Safety, certainly concurs that we're not quite there yet with that technology, but we do see that false sense of security, especially in young drivers. The older folks like me or older don't really trust those systems as much as our young drivers are trusting that the vehicle will respond appropriately at the appropriate time and protect them, so to speak. So very interesting to learn that.
I love that you brought that point up, Diana. I just want to highlight that I think one of the things we forget when it comes to ADHD is that another way to think about it instead of the term of attention deficit is that it's difficulty modulating attention. And so for different individuals, different things will sort of capture their attention resources, help them process more efficiently. And so I think in some cases, as you were giving that example, right, of a stick shift for driving, it is something, and Shannon, please weigh in here, it is something that with this sort of increasing bells and whistles that we can get in cars, some children actually might be really intrigued by the kinds of things that are going into cars now in terms of technology. And they may, once they learn about it and they learn the limitations, it could be used perhaps in a way that it's really got their attention, because you can track your average speed and mileage and all of this other kind of stuff in very different ways. So think about attention modulation, right? And what is it when you get in a car that's going to keep the attention of your driver most efficiently?
Very true. Maybe, you know, those mechanical engineer thinkers, Dr. Roberts, might be intrigued by the old school stick shift too. But one of the other questions that we received during the chat was from a mom or dad asking about medications. And I just want to echo your comments that, you know, at the start of the driving career, that's a really, really ideal time to speak to your clinician, your physician, about the addition of driving to the daily routine and the possibilities of medication changes. You know, the literature definitely shows that with stimulant medications, they can help with driving. I think about the last I read, about 60% of patients with ADHD are prescribed the methylphenidate medications like Ritalin, Focalin, Concerta, but then the other 40% take more of an amphetamine base like Adderall, which are slightly more potent. But I think the big question is, how long do these medications remain active in your system? I know a lot of students just kind of take it before school, before the school day. And then if it's, you know, kind of a time release, it's in your system about 6 to 8 hours. Think about, you know, is there an after school job or after school sports or activities where they would be driving themselves home, and maybe talk about the possibility of a short acting supplemental medication if they need to drive later in the day. The other thing is, you know, driving on weekends. A lot of young people with ADHD really do limit use of the medications to the school week and don't take it in the summer, don't take it on weekends. So that's something to consider as they start driving. But then anything that's labeled with a caution for driving implications should be discussed with the physician as well. And one of our, I think, our best resources at AAA is it's a website, public website you can go to called roadwiserx.com. Put in the name of the prescription, the dosage, and it will generate a report to explain to you how it could affect driving. Any comments from the two of you on medications?
Yeah, I'll just pop in real quick. It reminded me of another strategy that came up, that it's something I think it would be really good to help your children understand how impacted they are by that medication. And so if they do have off on the weekends, that's a time to practice some driving with them, and some techniques that they have talked about, you know, even when your child's in the car, if you're driving and maybe they're not on medication at that time, having them narrate, so they're talking through what the experience is like, having them practice scanning the environment, because for each child with the medication, there's such a level of individual difference in terms of how they metabolize it. So there is really sort of a lot of give and take to understand how the medication is going to be impacting that one individual. And so I would say that could be something that would be really important in your planning process, that even if you do intend to have medication in your system most of the time, you might want to plan for some practices where you do it without the medication, so that you can see what it's like perhaps in a safer environment, starting in a parking lot, you know, and then build your way up from there. But it's very much an individual difference thing here.
That's great advice, tremendous advice. And, you know, as a mom of a son who's a teen driver with ADHD. I also certainly, I know personally, I've had many conversations about impaired driving, just because of the way the data, what the data is reflecting. I know they've done a study out of the University of Kentucky and taking, two groups of participants, one with ADHD, one without, and using driving simulators probably not as advanced as yours, because this is going back a while. But the ADHD group performed the same way the drunk drivers did without ADHD, which was really scary to read. And then they also, later in the research, got both groups intoxicated at a 0.08 blood alcohol concentration. And again, the ADHD drivers performed far worse, even in that state. So I find that interesting. And then also, we have a team of traffic safety educators that have been delivering a program about marijuana impaired driving for high school students. And it was really surprising, I have to say, how many, kind of opened up and shared that their first interest in marijuana was more to control anxiety and ADHD symptoms. And they kind of started medicating with marijuana, but many were taking their prescribed medication for ADHD along with marijuana. So I think that's a tough conversation to have, but one that's, very much needed in this day and age as well, especially as marijuana has become legalized in the Commonwealth and in other places. So words from a mom. So.
And one other pattern that I've reflect on a lot is that the potential for particularly children with ADHD to overestimate their skills. And they may also overestimate skills or put an over-reliance on, say, the medication or on the technology. And so I think the real take-home is, even when you do find things, whether it's medication or some of the technology in the car that are helpful, that it's important for that new driver to really have a reliable, realistic sense of their strengths and weaknesses. And so whatever you do in terms of putting your driving plan together for them, I would say as much as you can emphasize to them, it's really important for you to understand who you are as a driver, because it will make you safer on the road. It will make others safer on the road.
Great reminder. And we do have parent-teen driving contracts available at our website, teendriving.aaa.com. I've many times over heard the advice, especially with young drivers with ADHD, to leave that contract in a very prominent place, like, that magnet up on the refrigerator, so they can sort of look at that every time they leave the house. But I love your tip about the app as well, to kind of review that checklist in the app before they take off. And then my final words of advice in terms of resources would probably be CHADD. That website, chadd.org. There's a lot of information there for teens with ADHD. And a great book that I've been recommending for a long time is ADHD and Driving, A Guide for Parents, by J. Marlene Snyder. And I looked it up today. It's available for $5 or less on Amazon, but it's real practical, has 20 steps for parents to promote behaviors, and even a lot of strategies on how to deal with poor driving behaviors once they're already licensed. So I liked that a lot. And you had mentioned another program. There's Behind the Wheel with ADHD.com, which is an online program. There's plenty of recordings for educators and parents at that website, and it's endorsed by the GHSA, CHADD, Dr. Russell Barkley promotes it. So I had pretty good confidence in that program, but I can't thank the two of you enough for everything you've done. And I really hope that we are able to keep in touch. And I hope for all the parents watching and the teens that we've given you some tools you can use. And thank you so much for this exciting research. We will be checking in with you, I promise.
Wonderful. Thank you so much.
All right, and congratulations.
Yeah, this was great. We were so happy to talk to you guys about this exciting research that we're doing.
Thank you so much for thinking of it. So take care, everyone. Stay safe out there, and don't hesitate to contact any of us with further questions. Have a great night.